Okay, so we have the pancreas gland. The effects on the body and the functions of the pancreas gland is that it aids in digestion, which means your pancreas releases juice into small ducts that flow into your main pancreatic duct. Your main pancreatic duct connects to your bile duct. This duct transports bile from your liver to your gallbladder. From your gallbladder, the bile travels to part of your small intestine called the duodenum. Both the bile and the pancreatic juice enter your duodenum to break down food. It also produces hormones. Your pancreas makes hormones that help control the levels of sugar in your bloodstream. When your blood sugar is too high, your pancreas makes insulin to lower it. When your blood sugar is too low, your pancreas makes glucagon to increase it. The structures affected by the pancreas is your brain, liver, and kidneys. Your brain is affected because the normal regulation of glucose homeostasis in normal and challenged conditions involves the modulation of pancreatic islet cell function. This compromises the pancreas intervention, causing islet autoimmunity in type 1 diabetes and islet cell dysfunction in type 2 diabetes. It affects the liver, and the liver can both store and produce sugar depending on the body's requirements. Insulin and glucagon signal whether the liver needs to store or manufacture glucose. The kidneys. Pancreatitis can cause serious complications such as kidney failure. Acute pancreatitis may result in the kidneys not filtering waste from the blood. Hormone cascades. So there are 5 hormone cascades listed on this slide. First one is insulin. Insulin plays an important role to keep glucose value within a relatively narrow range throughout the day. Amylin. It suppresses glucagon secretion from the alpha cells of the islets in the pancreas via paracrine interaction between beta cells and alpha cells. Glucagon. It is the source that alpha cells of islet in the pancreas. Glucagon acts exclusively on the liver to antagonize insulin effects on the hepatocytes. Somatostatin. It is the source of delta cells of the islets of the pancreas, hypothalamus, and D cells of the gastric glands. Ghrelin. Ghrelin inhibits the secretion of insulin from beta cells of the islets of the pancreas via paracrine interaction between delta cells and beta cells of the islets of the pancreas. Hormones secreted and the targets. So insulin and glucagon are the main hormones secreted by the pancreas. The primary organs targeted by the pancreas when secreting insulin are the liver, skeletal muscles, and adipose tissue, which are the fat cells. When the pancreas secretes glucagon, the primary target organ is the liver. Glucagon acts on the liver to stimulate the release of stored glucose in the bloodstream, thereby raising blood sugar levels. The pathophysiology for the disease cystic fibrosis. In cystic fibrosis, altered composition of pancreatic secretions, lower pH, reduced secretory volume, and higher protein content. These changes can be seen as early as 17 weeks gestational age in utero, with obstruction of small ducts in the sini. Pancreatic obstructions are initially composed of abnormal zymogen secretions, but over the course of the disease includes mucus accumulation from metaplastic epithelium lining ducts. Medication for CF, also known as cystic fibrosis. So you can get CTFR modulators, antibiotics, anti-inflammatory medicines, mucus thinning medications, which can be the hypertonic saline, bronchodilators, pancreatic enzyme capsules, stool softeners, acid-reducing medicines, specific medicines for diabetes or liver disease. And that's all I have.